All right, good afternoon, everyone, and welcome to the April webinar for the Virginia Governor's Conference on Aging, Medicare Coverage, the COVID-19 Vaccine, and Preventative Services. Before we get started, I'm just going to give everybody some buffer time to get in and get settled, and I'll start with a few housekeeping announcements before I hand it over to our presenters. We're really excited to kick off the 2021 conference, which will be virtual, and registration is already open. It'll be May 24th through the 27th. To register, people can go to vgcoavirtual.com. We're still looking for different volunteers, and there are other sponsorship opportunities still available. We have several registration rates that are open to the public. We have full registration for $90. We have a direct care worker registration rate of $50. And for that registration rate, there are a limited number of scholarships available thanks to a generous sponsor. Our conference speaker rate, those people know who they are $75. And we do have a student rate of $25 for anyone currently enrolled full-time in a 2 or 4 year undergraduate or graduate program. We find it very important to include those students coming up who are studying in the aging services arena. We also have an additional scholarship for our older Virginians that are age 60 and older with a personal interest in issues faced by older adults and caregivers. To access any of those scholarships or to find out more information about those scholarships, I will put more information in the chat box and I'll remind you at the end, but any questions can be emailed to info@vgcoa.com and we can help you with any questions you may have there. We also, one of the things that we are really excited about this year that we haven't been able to do previously, but we are working with the Virginia Assisted Living Association and Leading Age to provide several opportunities for continuing education credits. This is something that's been requested every year that we do it. So we're excited to be able to make that possible for those who claim credits from NAB, the Board of Nursing, and SHRM. If you are planning to claim any of those credits, to claim the NAB credits or the SHRM credits, you must register at the full conference registration or speaker rate as appropriate. We do know that some of those nursing credits are very important to PCAs and CNAs, so we're hoping that we can make that more available to them at that reduced direct care worker rate. We couldn't do this without the support of our amazing sponsors who have just gone above and beyond to support us through the transition from 20 to 21 and 21 into virtual and building out the webinar series. These sponsors have supported us from 2016 through today, and every year they come back and just say, what can we do to help? What can we do to bring this to Virginia? So thank you to all of our sponsors. And just because we're going virtual doesn't mean we don't have exhibitors. We have some really cool giveaways that our exhibitors are going to be doing, as well as a conference, we'll be doing giveaways for those who take the time to go to our virtual exhibit hall. We have some really cool interactive pieces. It's not just go in and meet the exhibitor. There's some exhibitors that are doing meditation sessions. There are some that are doing raffles. So we have all kinds of exciting stuff going on in our exhibit hall. And again, you can go to vgcoa.com or you can go to vgcoavirtual.com to find out any of that information. With that, I am going to quickly introduce our speakers who will be presenting today. Michelle Thomas is a program coordinator with the Virginia Insurance Counseling and Assistance Program, also known as VICAP, with Arlington County Government and the Arlington Area Agency on Aging. And Fong Tong is with the Office of Program Operations and Local Engagement, Region 3 Centers for Medicare and Medicaid Services. From there, Michelle, I'm going to hand it over to you. We will remind everybody that we are going to be taking questions at the end of the presentation. So feel free to put your questions in the Q&A box. And what we'll do at the end is we have the ability to allow you to unmute yourself and ask your question live. So we'll communicate with you on more directions how to do that. But feel free to submit any questions as we're going, and we can prepare ourselves for that Q&A at the end. Michelle, I'll hand it over to you to share your screen and start your presentation.
Thank you, Martina. Thank you for this opportunity. So pleased to be here. Hi, everyone. I'm happy to talk with you today and share some very pertinent information about Medicare Preventative Services and COVID-19. Today, I'll talk about and give you an understanding of the Medicare coverage options. We're going to talk about what's new in Medicare for 2021. I'd like for you to learn some information about Medicare Preventative Services and COVID-19. And then I would like to share some highlights from Arlington County's equitable distribution of the COVID-19 vaccine. So let's start with the overview of Medicare coverage options. There are two options that individuals can choose from: Original Medicare and also Medicare Advantage, which is also known as Part C. Under the umbrella of Original Medicare, there are Parts A as in apple and B as in boy. And individuals are able to add Part D for drug coverage. Under the umbrella of Original Medicare, there's also supplemental coverage, or some individuals call it Medigap. And then under the umbrella of Medicare Advantage plans, they are generally bundled. So there is Part A, B, and most plans come with Part D for prescription drug coverage. Sometimes individuals have the opportunity to partake in extra benefits. So that could be cooking classes, transportation, and so much more. But it's also really important to note that although the extra benefits are offered, does not necessarily mean an individual is eligible to receive them. I also want to really drive home that Medicare supplement insurance, also known as Medigap policies, only work with Original Medicare. So let's dive into a little bit more about the parts of Medicare. Under Medicare Part A, which is also known as hospital coverage, most people don't pay a premium for Part A if they've worked for at least 40 quarters and paid 10 years of FICA taxes. Now, that's not always the case. And so there are individuals who choose to purchase Part A. The costs vary, it's income driven. And so the cost that you would pay all depends on the amount of quarters that you have worked and paid towards your FICA taxes. In 2021, the Part A premium for a person who's worked less than 30 quarters of Medicare covered employment is $471 per month. And then those who have between 30 and 39 quarters of coverage may purchase it at a reduced monthly premium rate of $259 per month. With each part of Medicare, there could be a penalty if you don't enroll on time when you're first eligible. And I always tell individuals that I interface with that the penalty is for the life of Medicare. Under the umbrella of Part A, it helps to cover medically necessary items such as inpatient care in a hospital, inpatient care in a skilled nursing facility, also known as SNF, hospice care, and home health care. And I do just want to stop there for a minute before transitioning to let everyone know who may not be aware. Under the umbrella of home health care, it's not the general home health care where people may be thinking of someone coming in, cooking and cleaning, doing laundry and things of that nature. It has to be approved by your physician, and your physician has to coin it as being medically necessary. Transitioning into Medicare Part B as in boy, it's also known as medical coverage. Each year, parts of Medicare incrementally increase. For 2021, the standard Part B premium is $140.50 a month. And with this, the premiums also range. It depends on a person's income, or also known as IRMA. If people don't enroll on time, they could also face the late enrollment penalty that I talked about with Part A. And again, it's for the life of Medicare. Think about it as the 80-20 rule, where Medicare pays 80% and the beneficiary pays 20%. Under Medicare Part B, an individual is entitled to accessing preventative services if the doctor accepts assignment. And under Part B, which covers medically necessary items or services, think about going to the doctor. There's also outpatient medical and surgical services and supplies, clinical lab tests, DME, or durable medical equipment, diabetic testing equipment and supplies. There's a plethora of preventative services, which my colleague is going to go into more about. Home health care, and then medically necessary outpatient physical and occupational therapy and speech language pathology services are also covered under the umbrella of Medicare Part B as in boy. Under Part C, which is also known as Medicare Advantage, it's offered by Medicare approved private companies, and a person has to have Part A and also Part B to join Part C. You would still get services covered by Part A and B, and you have to live in the plan's network, or you can also think about it as the zip code area. Again, Part C is generally bundled. So most plans include Part D for prescription drug coverage. So if you join an MA plan, you'll be able to use healthcare providers. It's important to have the conversation to make sure the providers are in network so that you won't be faced with a surprise bill on the back end. Each plan has different rules. The doctors can change, the plan can also change, the coverage options can change, and that's why it's really important to make that assessment to determine if it's a good fit for you. So under MA plans, you may be charged different out-of-pocket costs. It just all depends. It's really important to note, though, that MA plans do not work with Medigap policies, and it's against the law to be sold a Medigap policy if you have a Medicare Advantage plan. And then transitioning to Medicare Part D for prescription drug coverage, most people pay a monthly premium for this, as well as a yearly deductible and co-payments. They all vary, but the lowest monthly premium plan that I was able to find in Virginia begins at $7.30 a month. The annual deductible is up to $435. Part D is also run by private companies that contract with Medicare, and you must have Part A and or B and live in the plan service area or the zip code area. You can add Part D to a original Medicare plan. And again, it's generally bundled under Medicare Advantage plans. It all depends. But the same rules apply. If you don't enroll on time, you could be faced with a lifetime penalty. Your costs could be less if you use a preferred pharmacy. And for individuals who have limited income and resources, we always talk to them about extra help, which is a benefit offered through Social Security Administration or Medicaid to be able to help them to reduce their Medicare costs. So let's transition and talk about what's new in Medicare for 2021. So last year, under the umbrella of Medicare Part B, it covered under up to 12 sessions of acupuncture treatment for individuals with chronic lower back pain. Starting at the first quarter of this year, Medicare Advantage plans now cover acupuncture for chronic lower back pain. You do need to get a physician's referral, and it's really important, again, to remain in the plan's service network, in-network. Under Medicare Advantage plans, starting at the first quarter of this year, Medicare beneficiaries with end-of-stage renal disease or kidney disease can now enroll in a Medicare Advantage plan during the Medicare enrollment period, which is towards the end of the year in the fall, starting in October 15th through December 7th. Under the umbrella of Part D for prescription drug coverage, starting in the first quarter of this year, if individuals who join a Medicare drug plan participate in what's called a Part D senior savings model, which is specifically geared towards individuals who need insulin, they may be eligible to purchase one of these plans and be offered to pay a maximum copayment of $35 for a 30-day supply. It's important to assess all of the plans to see what is a good fit for you. Other things that are new in Medicare for 2021, I just want to also plug the telehealth benefits that have taken flight. There are many individuals that are still participating in telehealth. At one point in time, it was specifically geared towards individuals who lived in rural areas. But when COVID-19 hit and changed the nation and changed the world, that we were provided with the opportunity to be able to communicate with our physicians virtually. So there is telehealth, there's something called virtual check-ins, and then there's something different called e-visits. For most services, the cost is the same as if you were to go in person. And then under the umbrella of Medicare Part B as in boy, COVID-19 tests and COVID vaccines are covered. Medicare beneficiaries pay nothing to receive those two benefits. And then under Medicare Part B as in boy, preventative services are also covered. So they're generally at no cost to the beneficiary, and people can obtain things like cancer screenings, shots, vaccines, lab tests, and yearly wellness visits. And a colleague will delve a little bit more into that, but it's really important to connect with your physician even during COVID-19 to find potential health problems early and also to remain healthy. So let's tease out a little bit about the Medicare coverage of virtual services. Telehealth is used for office, hospital visits, and other services that generally occur in person. Of course, it's not appropriate for everything, but it is an option, and individuals have definitely taken great advantage of it. It's also a good way to stay safe because you're meeting with your physician virtually in the comfort of your own home. And it's important to know, of course, that the provider must use an interactive audio and video telecommunication system that permit real-time communication while they are talking with the patients. So this is versus the virtual check-ins, which is for established Medicare patients where they're able to obtain a brief 5 to 10 minute virtual check-in with their provider by phone, text messaging, audio, video, or by using a patient portal device to consult and communicate with their physician. Again, this is all under Medicare Part B as in boy. And then the third option is the e-visits, which similarly to a virtual check-in, e-visits can only be reported when the billing practice has an established relationship with the patient. And individuals in this case would use an online patient portal to be able to communicate with their physician. Now let's transition and talk about Medicare and COVID-19. So under the umbrella of Medicare Part B as in boy, individuals have access to obtain COVID-19 testing and also vaccines. And if applicable, and for beneficiaries who have original Medicare or Medicare Advantage plan, if they need to, because it depends on where you're going. Some sites request the Medicare card, some sites don't. It just all depends. But as of April 18th, all Virginia residents and workers age 16 and older who live in Virginia are eligible for scheduling vaccination appointments. This also includes all undocumented immigrants. And then it's really important to know that the Commonwealth of Virginia will never call, email, or text asking for your Social Security number or payment as it relates to vaccination. And I just wanted to make sure I highlighted that because there have been a plethora of scams that have arisen from individuals trying to take advantage of this opportunity. So to prevent that as a beneficiary, it would behoove a person to, if they have original Medicare, to review their Medicare summary notice for errors. And on the other side, if they have Medicare Advantage plan, to review their explanation of benefits for errors. Continue to be cautious. Individuals are not going to go door knocking and all of those things to try to sell you something unless it is a scam. So please don't fall for any scare tactics or time-sensitive offers. There are a lot of fake charities out there, a lot of robocalls. I've received some of them, emails, text scams, and so much more. And so it's really important to remain aware of all of those things and to take action so that you're not victimized. If you think your provider charged you for an office visit or another fee, but the only service you received was the COVID-19 vaccine, please report that to the Office of Inspector General by calling 1-800-HHS-TIPS. And then to report Medicare fraud or abuse, please contact the Senior Medicare Patrol or SMP at 877-808-2468. Now let's transition and talk about some highlights within Arlington County's COVID-19 outreach. And here are some trends here. So as of April 26th, yesterday, just wanted to highlight that within Arlington County, there are a total of 15,007 cases of COVID-19 yesterday. There were 25 new cases, and there were 827 total individuals that are hospitalized. Yesterday, there were a total of 252 individuals who have died because of COVID-19. The hospitalizations were one, and yesterday one person died, but overall in totality, 252 people have lost their lives as of yesterday in Virginia, in Arlington County, due to COVID-19, unfortunately. And then as we look at some trends, Arlington County's COVID-19 cases by age, we can see here that the highest age bracket is between 40 to 59, although the other age groups remain steady. The lowest cases that we notice here are among the older adults, specifically 70 and up. But there are some ages that have not yet been reported, and we continue to follow these numbers and statistics daily. I do want to plug Arlington County's work around COVID-19 and also equitable outreach before I close and turn it over to my colleague. So from January 2021 to date, through what's called the Legends Outreach Team, which includes staff from the Department of Human Services, libraries, technology services, public recreation, public health, public safety, communications, and an emergency management team, over 5,000 Arlingtonians have been called and have either pre-registered and or the staff have scheduled them for vaccine appointments, in addition to scheduling transportation for individuals to be able to have the access that they need to get to their appointment. Arlington County has also been at the forefront of forming partnerships with Neighborhood Health Clinic, the Arlington Free Clinic, Macedonia Baptist Church, other nonprofit organizations for the purpose of addressing disparities and COVID-19 vaccination rates among Arlington's Black, Latino, low income, and other communities who have been severely affected by the pandemic. Through Arlington County's Complete Vaccination Committee, as of April 21st, over 950 residents have been pre-registered at more than 50 pop-ups, with 6,100 informational flyers and more than 1,350 COVID-19 prevention kits handed out and distributed in the community. And then as of this past Saturday, April 24th, Arlington County's Public Health Division has administered over 102,000 COVID-19 vaccines, and over 64,000 Arlingtonians have been fully vaccinated, according to the Virginia Department of Health. If anyone is interested, please call and getting a vaccine appointment, you're welcome to call 1-877-VACCINE-VA or visit vaccinate.virginia to be able to schedule your appointment online. They have a vaccine finder to be able to do that. And then in closing, I do want to offer some resources for you. CMS is always a great website that we defer to here in our program. And then the Medicare and You Handbook has so much great information, to include the list of preventative services that I've talked about, but my colleague is going to expound upon a little bit more. I'd like to share the Senior Medicare Patrol, who we work closely with in the Arlington VICAP office, the state health insurance program, which VICAP falls under, Vaccinate Virginia, and of course, the Virginia Department of Health's COVID-19 resource page. And if you are an Arlington County resident, you should contact Arlington's Virginia Insurance Counseling and Assistance Program. You can call us at 703-228-1725. You can email us at medicarehelp@arlingtonva.us. If you reside in Virginia, but you're outside of Arlington County and you want to contact your local VICAP office, you can call 1-800-552-3402. And then if you reside out of Virginia, but you want to find your local SHIP or state health insurance program, you can visit www.shiptacenter.org. So with that, I'm going to stop sharing my screen and pass the baton over to my colleague Fong. Thank you.
Thank you so much, Michelle. Good afternoon, everyone. Again, just as a form of reintroduction, my name is Foon Tong. I am a local engagement and administration staff member representing CMS Philadelphia Region 3. Thank you so much to Michelle and Martina, and of course, the rest of everybody for having me today. The presentation I'm going to be providing is Medicare Preventive Services via Part B. It's intended as an overview for educational purposes, and it's not intended as program guidance. So when we're finished, we're going to take questions at the end. Before I proceed to the next slide, I'd just like to provide a little bit of overview of CMS Philadelphia Region 3. We have program and operational jurisdiction over Region 3 states. So that's Pennsylvania, West Virginia, Delaware, Maryland, DC, and Virginia. So as Michelle mentioned, she provided a great overview and in-depth look at Medicare preventive services. My intention is to provide more of a general overview. So you can see on here that Medicare preventive services through Medicare Part B is important, may help or prevent health problems early when treatment is likely to work best. Medicare preventive services is covered by Medicare Part B, as in boy, which is the medical portion of Medicare Part A, B, C, and D. As a recap, you can receive Medicare Part B preventive services via the original Medicare route, which is also known as fee-for-service. You can also receive it via a Medicare Advantage plan or through other Medicare health plans. Coverage for Medicare preventive services is based on age, gender, and medical history. Most Medicare beneficiaries are receiving their Medicare Part B services through original Medicare. So when you seek Medicare preventive services, pay nothing for most preventive services if your provider accepts assignment. So basically, if they accept Medicare. You may pay more if you go and seek Medicare preventive services via a Medicare provider, a provider that doesn't accept assignment. There are certain preventive services which may have a copay or coinsurance. However, overall, Medicare Part B preventive services are at no cost to Medicare beneficiaries. As a LEA staff member, I am tasked and I have responsibility to provide information as wide as possible. This is a great opportunity to connect with ICAPs and SMPs and other individuals and stakeholders working in Virginia. So I just like to take this time to draw attention to this guide that we have. It's been around for a while. This is our guide to Medicare Preventive Services. You can order this product, which is available print at CMS product ordering website. We like to highlight the CMS product ordering website because it is a warehouse where there is a lot of approved and cleared information available for Medicare stakeholders and Medicare beneficiaries. You can sign up for an account at CMS product ordering at no cost. This is encouraging considering that I have been hearing from certain stakeholders that they are starting to incorporate in-office work back into their operations. And of course, working virtually also provides flexibilities to connect further and learn more from each other. So as mentioned, Medicare Preventive Services is covered by Medicare Part B, B as in boy. This publication I have on here that I'm bringing attention to is a list of what services are covered via Medicare Part B. I'd like to draw your attention to the first item on the list here. It says, welcome to Medicare Visit. That is a visit that is at no cost to the Medicare beneficiary when the beneficiary picks up Medicare Part B. So you may encounter certain individuals that pick up Medicare Part B later because they are continuing to work past 65. That's one of the groups that we continue to target to get the message out, because preventive services offers a venue to detect problems earlier when it can be more easily fixed or more easily addressed. So when we conduct outreach and education activities, we encourage Medicare stakeholders to let more and more people know about Welcome to Medicare Preventive Visit, because it establishes a baseline. So in order to establish baseline, the Medicare provider needs to have a PCP or a primary care provider established. The Welcome to Medicare Preventive Visit is at no cost, and the PCP and the beneficiary can establish a baseline, measure basic stats such as weight, blood glucose level, cholesterol, and that gives a little bit of preview on the health status of an individual or the beneficiary. So that is, for example, year one of being a Medicare Part B beneficiary. And then of course, annually, a Medicare beneficiary also receives a wellness visit. This is once per 12 months. It is in follow-up to Welcome to Medicare. So as a Medicare beneficiary, the beneficiary will get one wellness visit per 12 months after the Medicare Part B portion becomes effective for that individual Medicare beneficiary. You can see on list of this is available. If you have any questions about this list and this publication, I'm more than happy to share as a resource page afterwards. I understand there's going to be a resource page that's going to be sent out to attendees and participants after today. This is an additional list. It is a more comprehensive listing. We periodically and as much as possible come out into communities, provide presentations and informational sessions for Medicare stakeholders alike. And of course, we continue to communicate about the hepatitis C and B screenings, mammograms, pap smears, and then of course, other conditions such as counseling for prevention of tobacco use or alcohol use. My colleague Michelle has provided great in-depth into the Medicare Part A, B, C, and D. So this is intended as Medicare Part B preventive services. So again, I like to highlight and just provide a list, a comprehensive list of what's available to Medicare stakeholders when they are providing counseling services to Medicare beneficiaries and or clients. CMS, there is no wrong door to CMS. So your VICAP counselors, the SMPs in Virginia are experts and continue to be in partnership with CMS staff members. However, if you need to reach out to CMS staff members, you're more than welcome to reach out to me. I understand there may be many on the call that have worked with my colleagues in the regional office. You're more than welcome to reach out to my colleagues in the regional office. And of course, we also work with central office, so we collaborate and work as close as possible with each other. The Social Security Administration is another agency that, CMS staff members work with as well. Many times when we work with the Social Security Administration, it's in regards to Medicare enrollment and eligibility, particularly regarding Medicare Part A and B, and of course, questions that may be coming up with IRMA, whether it's Part D as in dog or B as in boy. Michelle is one of our SHIP colleagues. So you may be aware that nationally there are SHIP programs throughout different states. We continue to appreciate the partnership that VICAP and SMPs provide in Virginia. Medicare Learning Network is our provider network. There's great information on there if you're looking for coding updates or if you are reviewing a Medicare summary notice with a beneficiary and it appears like it is a covered services yet is not a covered service. This may be a venue to check out resources and more intensive educational materials available through the Medicare Learning Network. We also have the flu campaign page here through one of our HHS active sister agency, the CDC, otherwise known as the Center for Disease Control. Flu information and flu campaign is one that Leah actively engages with and has successfully completed last year, rolling into early this year. You may be aware that flu season is typically September through February and or March. So flu is also one of the leeways that we communicate that leads into active communication to take down COVID-19, to take down the COVID-19 pandemic. Here's additional publications available through Medicare program. I encourage you to visit productordering.cms.hhs.gov. They are partners in central office, as well as publications coming out from various different departments of CMS. So now that I provided an overview and additional information sources for Medicare Part B preventive services, I'd like to just draw your attention again that Medicare provides free coverage for COVID-19 vaccines. So when you are a Medicare beneficiary, the COVID-19 vaccine is provided to you at no cost. That includes the product and the administration. We are collaborating with the FDA and the CDC on the campaign to take down COVID-19 and of course provide education about the COVID-19 vaccines. You can see on here there is a list of the certain highlights. I will apologize in advance that these slides are a bit outdated. They were created originally when we rolled out the COVID-19 vaccines, which was in late January 2021 to early February 2021. So I will weave in some words to update these slides. This is just a process on how the FDA provides evaluation of it or comes to an emergency use authorization for the evaluation of a vaccine. So it is a process that a vaccine would have to go to in order to pass and be authorized for public use. There's a process for checking the chemistry, manufacturing, and controls information for the vaccine, data to ensure that the quality and consistency of the vaccine is good to go and is going to not cause harm. There are records, site visits, and compliance history that goes into the process as well. This information comes from the FDA. The authorization comes from the FDA. So my goal today is just to let you know that there is a process that the FDA goes through. And the FDA stands for, of course, the Food and Drug Administration agency, and that is a sister agency of CMS. The vaccines are monitored for adverse effects. So when the vaccines are in trial phases, they are monitored for adverse effects. Then the CDC provides approval if and when the vaccine passes through the FDA process. And within each of those processes, there are additional steps as well. I'm not going to go too much into the weeds. I am not a CMS, I am not a CDC or FDA official. I would like to know that there are monitoring systems available for the public. So for example, if you would like to connect to the CDC and let's say you are getting the COVID-19 vaccine and you have received your first dose and you're experiencing certain side effects or adverse effects, there's a vSafe Smart app that you can download or visit online as a beneficiary or a client or a consumer receiving the vaccine. There's also the National Healthcare Safety Network. That's more for long-term care facilities. So they're more for providers working in long-term care facilities. And of course, there are large databases and payer-based systems as well. And these systems are available for populations to help monitor the adverse effects of COVID-19 vaccines. CDC is the agency that provides recommendations for federal, state, and local governments about who should get vaccinated first. So specific to Virginia, you have entered phase 2 in Virginia, which is everybody. Prior to that, there was phase 1A, 1B, and 1C. The recommendations that CDC keeps in mind when they are providing recommendations to federal, state, or local government partners is to decrease death and serious disease as much as possible, preserve a functioning society, reduce the extra burden that COVID-19 is having on people facing disparities. We are actively communicating as much as possible to reach in-depth communities who may be needing or help in need of more words and communications so that they are confident when they are to get the vaccine or the COVID-19 vaccine. Along the lines of that, it's important for us, it's important for myself as LEA staff member to build trust in public messengers, build trust in audience members such as yourself across all communities. The goal is to get the COVID-19 vaccine information out to as many people as possible so they are aware that the vaccine is available. And the best way to get updated information is through local health departments. So specifically in Virginia, you have seen the links that Michelle has provided. I encourage you to visit those links. They are your local state experts. There are target vaccine information for specific populations. We have that available on CMS.gov. We have all kinds of information. We're communicating actively as much as possible to as many partners as possible because we want to remove barriers to access and to cost. If there are individuals in your communities who may not have insurance or underinsured, they are welcome to visit FQHCs or open vaccine clinics. However, I would like to remind everybody that your best source of information continues to be those links that Michelle shared towards the end of her presentation. I have about 6 to 7 minutes. I'm going to go through the list of why COVID vaccination program is so important. The safety of COVID-19 vaccine remains a priority, particularly for HHS Optive Sister Agency. CMS is communicating as much as possible about COVID-19 vaccine. Recently, there is a pause in the Johnson & Johnson vaccine, otherwise known as J&J or otherwise known as Janssen. The pause is due to adverse effects that was noticed or reported from a number of beneficiaries or clients who received the vaccine out of approximately 6.7 million dosages that were provided. Number 2, COVID vaccination will protect beneficiaries and stakeholders from COVID-19. 2 doses are needed. In about 2 months ago, there were 3 different types of vaccines publicly available: Moderna, Pfizer, and J&J, otherwise known as Johnson. Currently, there are 2 publicly available. So for example, if you are to register to go receive your vaccine, you may be offered the Pfizer or the Moderna, and each of those require 2 doses. So for example, for myself, if I were to sign up to receive the vaccine, then I would receive 1 dose, and then about 21 days later, I will be receiving my 2nd dose. 3, to remind everybody that the CDC is making recommendations on who should be offered the COVID-19 vaccine first. Again, these slides are from early February. So right now there are more supply of vaccines available. The best way is to register with your local health department to make an appointment to receive your vaccine. And if you're a Medicare beneficiary, it is at no cost to you. Number 4, again, the supply of vaccine have increased since the production of these cleared slides. So there are vaccines available. Please visit your local health department or your Virginia partners to receive updates about the vaccine. After the COVID-19 vaccination, you may have side effects. I highlighted one of the apps that you can visit or one of the websites that you can visit as a client, consumer, or Medicaid beneficiary to report any adverse effects. That goes directly to the CDC. Cost is not an obstacle. That's number 6. We want to communicate as much as possible, widely as possible to Medicare beneficiaries, Medicare stakeholders, and any partners that cost is not an obstacle to get the COVID-19. Our goal is to build herd immunity in order to take away the pandemic so that we may return to a life that was prior to the pandemic. 7, the first COVID-19 vaccines are being used under the EUA. So this is a point that was made in the early phases of COVID-19 vaccine rollout. As far as trials, currently there are clinical trials that may be in place for COVID-19 vaccines for individuals 16 years old or less. 8, COVID-19 vaccines are one of the more important tools to help us stop this pandemic. Right now, I will say that as of April 26th, which was yesterday, that the number of cases in Virginia is decreasing. And as far as more stats on COVID-19 cases, the range for Virginia is in the range of 3,416 to 5,594 per 100,000. That's the rate of cases. for COVID-19, and that was observed between January 1st, 2020 to February 2nd, 2021. There are certain populations that may be more at risk. So as far as number of cases in Virginia, particularly COVID-19, rural populations, it's a slightly higher number. So it's 6,414 per 100,000. And for urban in Virginia, it is 6,138 per 100,000 individuals. American Indians and Alaskan Natives continue to have the highest COVID-19 hospitalization rate, followed by African Americans. So I appreciate everybody's attention today. I am coming up on my 20 minutes. I'm going to take a pause, but I'd like to remind everybody that as of April 26th, the COVID-19 cases or new cases is decreasing within the last 7 days. Thank you so much for having me. I'm going to take a pause and please go ahead, Martina, with the questions.
All right, thank you. So we're going to move into questions. Let's see. Does anybody have any questions? You can either submit them through the Q&A box, or you can raise your hand and we can unmute you and you can ask your question live, or you can send a note to let us know you have a question you want to ask live. As a reminder, we got several notes throughout, which is always the case, that the webinar is being recorded and it'll be posted to our webinar page on vgcoa.com. And I will put that in the chat. All of our webinars can be found online. They are recorded, and the ones that we have coming up, we are going to continue this webinar series through the end of the calendar year and into 2022. It's been very well attended and very well received, thanks to all of our supporters. So we are going to continue with some other really interesting topics that have been requested from other presenters, or excuse me, from other attendees. If you have a webinar that you'd like to hear more about, or a topic you'd like to hear more about, or a speaker, we'd be happy to entertain that as well. Let's see if we have any questions in the Q&A. We will send out an email within the next 24 hours that has all of the slides and resources available, as well as the link to VGCOA Virtual. You guys must have done a great job presenting. We don't have any questions at the moment. All right. Well, Michelle, do you have anything that you want to wrap up with, or any closing remarks before we wrap up? And if we get any other questions, people can always, all your contact information will be listed in the follow-up email. So if contacts want to follow up with presenters, then they can follow up individually. But Michelle, do you have any, or Fong, do you have any closing remarks?
Nope, I just want to say thank you all so much, and I will definitely share the PowerPoint presentation with Martina so that she can share it with all of the attendees. And if you're interested in remaining connected to all of the changing news coming down the pike around the vaccines, please do stay tuned to Vaccinate Virginia to obtain the most updated information, in addition to the Virginia Department of Health. Every locality in Virginia, I think, is doing such a great job, to include our regional partners, because we're so close to Maryland and also DC, but in getting the word out about the COVID-19 vaccines. And if any questions arise on the back end around my presentation, I'd be more than happy to speak with you individually. And also, if you're not an Arlington resident, but you reside in the state of Virginia, direct you to your local SHIP. So thank you so much.
And Michelle, one quick thing that came in, and I think I saw a note from you earlier, is that the J&J vaccine is available again in Virginia. Is that correct?
Yes, thank you. The pause has been lifted according to the CDC, and There are many localities in Virginia that have started to offer the J&J vaccine again with a disclaimer. And so individuals have the opportunity of selecting J&J if they so choose, just understanding the potential implications of getting the J&J vaccine, but also knowing that the blood clots that have been mentioned with the J&J have been far and wide in between, and the CDC is investigating that. But if anyone else has any other questions, please do let me know. Martina will share our contact information, and Fong, thank you for the collaboration, and Martina, thank you as well. And I look forward to seeing you back in May.
Absolutely. Thank you both for being here and taking the time, and for our attendees. And Michelle, you're presenting at the conference, so thank you for doing that. And you guys have received a lot of praise in the chat box for being very informative. So that means that you did a great job. That's why there are no questions. So thank you guys again. You see all of the contact information here, but again, we'll provide that in the follow-up email. So have a great afternoon, and we look forward to seeing you May 24th through the 27th at the Governor's Conference on Aging. Thank you.
Thank you. Bye-bye.
Bye.